everyone, I'm Sheila Suplig from BSN 2B. For today, in this video, we're going to discuss the procedures related in initiating, maintaining, and terminating a blood transfusion using a Y set. The purpose of this procedure is to restore blood volume as well as the oxygen carrying capacity of the blood after a severe hemorrhage. This is also used to provide plasma factors such as anti-hemophilic factor or platelet concentrates, which help prevent or treat bleeding. Before performing the procedure, it is important to first check for the medical's order. Verify the identity of the client. The equipment needed for this procedure include unit of whole blood, blood administration set, IV pump, 250 ml normal saline for infusion, IV pole, venipuncture set containing gauge 14 and 22 catheter, alcohol swabs, tape, and gloves. Hello, good morning, Ma.
Good morning.
I'm Sheila Suplig, your student nurse for today. So, before we go on with the procedure, may I just verify your identity? Can you please state your name as well as your age? Okay, thank you very much. So, for today, we're going to perform a procedure called blood transfusion. So, ang purpose po niya is to restore the blood volume after a severe hemorrhage. It is to ensure that the oxygen carrying capacity of the blood is within the normal levels. And also, there's a small risk accompanied by the procedure. So after the blood transfusion, you might develop some infections and also incompatibility of the blood to your body. So there's a possibility that your body might reject the blood. Okay? So, along with the procedure, your utmost participation is highly encouraged, and also, I would like to ask
Provide
for your
for client's
permission to
privacy
perform the
by
procedure.
closing curtains and doors.
So, thank you very much.
Provide for client's privacy by closing curtains as well as doors. Assist the client in a comfortable position, either sitting or lying. Expose the IV site but provide for client's privacy.
Perform hand hygiene and observe other appropriate infection prevention procedures.
Apply gloves. Prepare the infusion equipment. Ensure that the blood filter inside the drip chamber is suitable for the blood components to be transfused. Attach the blood tubing to the blood filter if necessary. Close all clamps on the Y set, the main flow rate clamp, and both Y line clamp. Insert the piercing pin into the saline solution. Hang the container on the IV pole about 1 meter above the venipuncture site. Prime the tubing. Open the upper clamp on normal saline tubing and squeeze the drip chamber until it covers the filter and 1/3 of the drip chamber above the filter. Tap the filter chamber to expel any residual air in the filter. Open the main flow rate clamp and prime the tubing with saline. Close both clamps. Start the saline solution. If an IV solution is incompatible with blood that is infusing, stop the infusion and discard the solution and tubing according to agency policy. Attach the blood tubing primed with normal saline to the IV catheter. Open the saline and main flow rate clamps and adjust the flow rate. Use only the main flow rate clamp to adjust the rate. Allow the small amount of solution to infuse to make sure that there are no problems with the flow or with the venipuncture site. Obtain the correct blood component for the client. Check the primary care provider's order with the requisition. Check the requisition form and the blood bag label with a laboratory technician or according to agency policy. Specifically, check the client's name, identification number, blood type, and RH group, the blood donor number, and the expiration date of the blood. With another nurse, verify the following before initiating the transfusion: order, transfusion consent form, client identification, unit identification, blood type, expiration, compatibility, appearance. If any of the information does not match exactly, notify the charge nurse and the blood bank. Do not administer blood until discrepancies are corrected or clarified. Sign the appropriate form with another nurse according to agency policy. Make sure that the blood is left at the room temperature for no more than 30 minutes before starting the transfusion. Prepare the blood bag. Invert the blood bags gently several times to mix the cells with the plasma. Expose the port on the blood bag by pulling back the tabs and insert the remaining Y-set spike into the blood bag. Suspend the blood bag. Establish a blood transfusion. Close the upper clamp below the IV saline solution container. Open the upper clamp below the blood bag. The blood will run into the saline-filled drip chamber. If necessary, squeeze the drip chamber to re-establish the liquid level with the drip chamber 1/3 full. Readjust the flow rate with the main clamp. Observe the client closely for the first 15 minutes. Note adverse reactions such as chills, nausea, vomiting, skin rash, dyspnea, back pain, or tachycardia. Remind the client to call a nurse immediately if any unusual symptoms are felt during the transfusion.
So, now that we've started the blood transfusion, ma'am, I would like to ask you and to report me that any signs such as dizziness, nausea, or
Monitor the
vomiting,
client.
and also skin
Assess
rash
the
and
client,
sudden chills,
including
report
vital
to me
signs per
immediately
agency
so we can
policy.
stop
If the client
immediately
has a
the
reaction and the blood is discontinued,
that is okay.
send the blood bag and the tubing
So,
to the laboratory for
after the
investigation
blood
of the blood.
transfusion, all of the data will be documented, and also your doctor or your physician will further discuss your condition. So, thank you very much, ma'am, for cooperating.
Terminate the transfusion. After terminating the transfusion, measure the vital signs of the client and monitor normal findings and abnormalities. Follow agency protocol for appropriate disposition of used supplies. Remove and discard gloves and perform hand hygiene. Document relevant data. Record the completion of the transfusion, the amount of blood absorbed, the blood unit number, and the vital signs. If the primary IV infusion was continued, record connecting it.